So good morning, everyone, and thanks for joining us for day 2 of our annual Ethics Symposium. For those of you who weren't here yesterday, just joining us now, my name is Nicolia Lukic. I'm one of the regional ethicists at the Champlain Center for Healthcare Ethics. Before we begin, we'd like to pay respect to the Algonquin people, who are the traditional guardians of this land. We acknowledge their longstanding relationship with this territory, which remains unceded. So just a couple of housekeeping notes before we get started. And if you were here yesterday, I apologize for the repetitiveness. But if you are new to the on-air program, to learn more about the features of the portal, you can click the purple Take a Tour session in your symposium timeline right at the top. And then during the presentation, we ask that you use the live Q&A chat box on the right-hand side of your screen to ask questions during the presentation. We will be having questions at the end, but feel free to put in your questions throughout the presentation. And following each session, please click on the Back to Timeline feature and take a moment to complete the brief evaluation. Like yesterday, we have some exciting prizes to be won at the end of the day, and you can do so by earning points through joining a session, asking a question during a session, answering a poll, answering a trivia question, which is if you click on the Win Points trophy at the top of the screen during the health break, as well as completing an evaluation. And so for every 200 points earned, you will get a ticket for the draw. And like I mentioned, we'll draw at the end of the day at 1 o'clock. This event is accredited for up to 7 Section 1 hours and 7 Main Pro Plus credits, and any certificates of attendance will be released via email within 2 weeks. All the sessions will be recorded, and the recordings will be posted on the virtual portal within 1 to 2 business days following the symposium, and they will remain there for 1 year. And should you encounter any technical difficulties, please click the red live support icon in the top right-hand corner of your screen. There is a University of Ottawa CPD team member standing by. Okay, so let's get to our first session of today. Our presentation today is titled Housing and COVID-19, a panel to discuss the ethical issues regarding housing, homelessness, and vulnerable populations. And it will be presented by Mike Wade, Beth Lusk, Kim Van Herk, and Justine Joseph. The presentation will be going until 10, but we will have time at the end for discussion. So Mike Wade is an Assistant Director of Community and Housing Services for Youth Services Bureau. With over 10 years in the housing and homelessness sector, he brings a wealth of knowledge and practical experience working with marginalized and vulnerable clients, many of whom are experiencing challenges with mental health, addictions, justice involvement, and poverty. Working from a Housing First for Youth framework, he implemented the Ottawa site for the Making the Shift national research program, studying the effectiveness of Housing First as an intervention to end youth homelessness. He now directs and oversees YSB's youth shelters and housing-based case management team to ensure services are client-driven and developmentally appropriate. Beth Lusk is a nurse coordinator, team lead at Ottawa Inner City Health. Beth has been working with OICH as an RN since 2008, caring for people who are homeless and are facing many complex physical, mental health, and social issues. Prior to her work at Inner City Health, Beth worked as an RN in general surgery and urology at the Ottawa Hospital Civic Campus. Kim Van Herk is a registered nurse with a Master of Science in Nursing. She is the mental health team lead at Ottawa Inner City Health and has worked with the homeless for more than 13 years. And Justine Joseph is the Housing Programs Coordinator who currently leads a community housing team of 8 individuals, ranging from case managers, housing specialists, and peer support workers. Justine is in her 8th year with the John Howard Society of Ottawa, with a range of experience in housing with youth and adults. Justine completed her honors specialization in criminology with a minor in psychology at the University of Ottawa in 2013. Originally from Cambridge, Ontario, she moved to Ottawa for university, never thought she would stay, and is still there 11 years later. Justine has a passion for patient-centered work and is a strong advocate for systems change. Justine has always believed ending homelessness is possible and prides herself on being ready and willing to try innovative and new responses. While not working, she enjoys playing with her 1.5-year-old daughter, playing softball, and binge watching TV. So with that, I want to welcome Beth, Kim, Justine, and Mike. And before we get started, we're actually going to start our polls. So there's 4 different polling questions, and I ask you to just answer them honestly. We want to get a pulse of, who's in this session, what is our experience. So I'll start the polls now. So you can answer all 4 at the same time, and we'll wait just a couple of seconds. So like I mentioned, there are 4. So just a couple more seconds here to get some more results. Okay. So there's like 2 more seconds. If everyone just wants to answer the poll questions. Okay. So I'll very quickly just share these results with everyone. And for all the presenters. Okay, so the first question was, do you work with individuals experiencing homelessness? 30% say yes, 70% say no. Do you work with vulnerable youth populations? About 24% said yes, 76% said no. Do you work with individuals who are involved in the justice system? 28% yes, 72% no. And do you work with individuals who struggle with complex mental health and addictions? 49% yes and 51% no. So more of a 50-50 split on that one. So with that, we sort of have an idea of who's in the audience here, and I'll turn it over to our presenters to share the screen and start their presentation.
Thank you. Good morning, everybody. So my name is Justine, and I'm going to start with talking about the justice involved individuals. Thank you for answering the poll. That's really interesting. And often, maybe sometimes we can broaden our view of who justice involved individuals are, as well as youth populations going into transitional age youth and homeless population, those who are maybe underhoused, couch surfing, staying somewhere that they're 1 month away from eviction, those types of things. So that's maybe something to keep in mind during our conversation here. So justice involved individuals and how they've been affected during COVID-19. So as we know, jails and prisons are often overcrowded, overpopulated, and that makes social distancing just impossible. There are often outbreaks, quarantines, and segregation. This creates a time where there's lapse of services. We're not able to contact them, we're not able to serve them, and we're not able to plan for their release. There has also been an increase in releasing individuals quickly without any discharge planning. This has obviously positive intention and getting people out of the overcrowded situations, but when they come out, they don't have anywhere to live. We're also looking at individuals needing time to quarantine or isolate following release sometimes, and there's no places to safely do that. And when they're doing that, they can't access services to look for housing. This just elongates the time that they're either street living, couch surfing, or shelter living, which is unfortunate. And this is a lapse of time that we weren't seeing before the COVID-19. We were able to work with them right when they were released. Okay, next slide, Mike. So some safety precautions and service provisions for this population. Many services have moved to virtual, phone, and by appointment. This includes services from our agencies, other agencies, and also landlords. Landlords have moved to virtual viewings, virtual lease signings, and interacting only by email. As you can imagine, this is not accessible for many of our clients who do not have the necessary technology or also do not have the skills or experience of doing this. There has been a decrease in home and community visits and an increase in in-office meetings where we can control the environment with protective equipment, plexiglass, contact tracing, that kind of thing. But of course, this is much less accessible to those who maybe need to meet on a crisis basis, less planned basis. They struggle with mental health and anxiety, would have typically had those meetings in the place that they do live. And there's also been some shelter outbreaks, and that creates limitations because they may need to quarantine or self-isolate, giving us a chance where we can't see them for up to 14 days. There's also rules with viewings of apartments where only one person can go in, if anybody. So this cancels our opportunity to advocate or be there during those times and do role modeling or accompaniment for those with high anxiety or just lack of experience with interacting with landlords. These times were vital before this time, and also it's still vital now to do that advocacy because often that is the biggest sell point for landlords to rent to the population that we're serving. Okay, next slide.
Justine, I'm
Oh,
gonna
yeah.
do one of those quick jump in
Of course.
points here. One thing I wanted to touch on too around the virtual meetings, that presents a real challenge from a housing first perspective. Once you do end up having someone housed in the private market or out in the community, you actually, as best practice and just generally a really good client-centered approach to meet the client where they're at, you need to get eyes on that unit, especially if it's someone with more severe addictions issues or serious mental health. So it can become quite problematic when you're just doing a quick phone check-in and you're texting them and saying like, hey, how's everything going? Everything's fine, please don't come. And you're like, what do you mean by that last part? So the eyes on is incredibly important. And I just want to harp on how much more challenging it's become with the landlord meetings that Justine has kind of highlighted. Literally everything's gone virtual. And in terms of actually getting client involvement, client participation, because it's a huge part of making such a enormous decision around where you want to live, you can do all the virtual viewings you want in the world. But then when you get there and you actually move in, oh, I don't like this place. Actually, it's not as close as I thought as it was to, and it becomes very difficult to actually effectively engage clients in the decision-making process, which is key to a good client-centered approach. So that was my touch point, Jesse. Next slide. Good.
Yeah, I also will just echo what you're saying about the home visits. We are trying to balance the safety of our staff as well as the safety of our clients. So often we say like only home visits if it's absolutely necessary or if it's for their health and wellness. So clients can tell you they're doing great, and in that case you meet them outside or you meet them at the office, and then really we don't get eyes on that unit to see if they are doing great in their housing. So yes, next slide. But I will echo what Mike said. That is very very relevant. So barriers specific to the justice involved population when it comes to housing. So there are many barriers, but I highlighted some of them. Gaps in housing history due to incarceration. So often landlords look for a very detailed application, and that can include saying, where did you live in the last 2 years? Where did you live before that? What are the names of all your landlords? In that case, individuals don't know what to put down because they have been incarcerated in that time. Lack of references, guarantors, or co-signers. So often, because of the lack of housing history, they're asking, can I have a bunch of references? Can I have guarantors? Can I have co-signers? Many people are being released and they're choosing not to engage with the people that they were engaging with before, given the circumstances. So they don't have many non-professional networks in their life. So that would take away any opportunities for guarantors or co-signers. Ongoing court proceedings and conditions. So there are lots of conditions that are placed on people that are on either parole or probation, and that can include where you're allowed to live, who you're allowed to live with, and just the fact that you do need to have an address, as well as ongoing court proceedings can have the threat of going back in, which you would then not be able to pay your rent and not be able to stay housed. Crime-free housing. So there is an initiative in Ottawa with the Ottawa Police that's called crime-free housing, and landlords are able to register as crime-free housing, which means you cannot live there if you have any sort of criminal record, and they use this as a marketing tool to market for their units. Of course, this is a very big barrier for anybody who has a justice involved history, and landlords that are not deemed crime-free housing are also still doing criminal record checks. So it's quite a big limitation in our city. Additional steps to being document ready. So in order to access things like a housing allowance or the social housing registry, individuals do need to have their taxes up to date. They need to have photo ID. They need to have a whole bunch of documents that often people are coming out of custody without, or their taxes haven't been done for quite a long time. And then just general discrimination. I think that it goes without saying that there is a human element of choosing who's going to live in your place, and for good reason. But there is quite a lot of discrimination against the clients that we serve. Yep.
Yeah, just really quickly, I touched on some of this yesterday in my presentation around youth specific barriers. All of these things apply to youth as well for various kind of different reasons. But one of the things really that adds that extra little component is age. So the older adult population gets the same kind of level of discrimination as youth, but youth get this additional age thing on it where you have this whole, well, they're just 16, they're 17, they can't legally sign that. That's not true. They can legally sign things, but they're irresponsible. They're just going to have a party. I mean, one of my favorite stories that actually happened recently within the past 2 years is we have social housing in YSB. And so an officer was responding to a situation that occurred in one of our buildings. I happened to be there to kind of help out. And he said, so like, what is this? Just like a frat house for kids? Just a party house where they all get together and just party? And you're like, nope, this is an apartment building for young people. So there is this preconceived notion regardless. And I think it comes out in pretty much all walks of life where we dismiss young people's capacity to be able to do the things that we expect other adults are able to do. So that's kind of my touch point on that.
Absolutely. Yeah. So further justice involvement and current court process, just a little snapshot of what that looks like right now. So we are seeing additional police interactions due to COVID-19 guidelines and bylaw calls. So often the individuals that we serve may be already known by Ottawa bylaw and Ottawa police. People are calling police on if they're having, friends over to their new place or whatever, or they're sleeping outside or they're staying in a park, whatever. And this is causing additional police interactions, as well as visitor limits and definition of household. I thought it was interesting to point out that there are rules about not having people outside of your household in your household, but often when we house people, they want to extend the welcome to their street family, and that's who they define as family, and that's who they define as the people close to them. And there is that feeling of, I have a place to stay, I'm going to offer it to the people that are around me, and that automatically puts them in infraction of some of the COVID-19 guidelines, as well as missed probation and parole meetings, which are creating new charges. We're seeing that a lot because of probation and parole going virtual for some of their meetings, and the missing technology, the missing Wi-Fi, if you're street living, just not having a place to charge your phone, that type of thing. And breaking reside conditions. So a reside condition means that your parole or probation officer can tell you where you need to stay. And sometimes that is the shelter address. Sometimes that's the address of the place you lived before you went in. And if you can't stay there for whatever reason, whether it's because you feel unsafe or there is an outbreak, or you think that you're safer to stay on the street and away from people that may be infected with COVID-19, you are breaking that condition and can go back to custody. Also, people cannot be granted bail without an address. So if you have nowhere to go and you're having one of those expedited discharges, you can't be granted bail. You would be spending your bail time on remand in custody. And that's all because you have nowhere to stay or nowhere that you feel is safe that you can stay. And there have been, I think this goes without saying, but there have been lengthy wait times for court dates and cases being postponed. So a lot of uncertainty in this population. A lot of people that say, why even look for housing if I don't know if I'm going to serve time and I don't know when my court date is, and it just keeps getting postponed. So that is a huge limitation, and it does affect people's mental health negatively to think I'm in this limbo and I can't figure out where I'm going to live, because what's the point in doing that if I don't know if next month or 2 months from now I'm going to have a court date and have to spend some time in custody. So those are the specific limitations we're seeing because of the current court processes as a result of COVID-19.
A really quick addition to that is housing generally is like a really bureaucratic. So outside of the justice system, housing is a really bureaucratic system. So I've been actually pleasantly surprised with how responsive many of those systems continue to be within COVID-19. But certainly there is a backlog in getting things done. Access to completing these systems, getting what you need from them is incredibly important, especially when you're looking at private market. A lot of that is just competition based. Ottawa, we're very fortunate. We're a very rich municipality. We have 3 levels of government. We have a very robust private sector. The average annual income is quite high and our vacancy rate is quite low. So the first person to show up with the check wins in a lot of times. So when you're looking at actually doing some of these private market, you can access it, absolutely, but we have to go through a whole series of challenges that someone who's not accessing social services does not have. So it's another consideration on top, is that the kind of COVID's ground the gears to start working a little bit slowly. They're working, but still it's too slow. And for youth specifically, Justine's point about multiple people, multiple households, couch surfing and hidden homelessness is one of the defining features of youth homelessness. I personally would say at any rate, we see it quite frequently. So that is an added challenge specifically for youth. I mean, you definitely see it in the adult population, but it is just so common in youth homelessness that it is like, where do you go to safely isolate? If you have symptoms, if you're awaiting testing, how do you get access to that? Are you even going to be able to stay at this same place tomorrow, or are you getting kicked out? So it's all kinds of different considerations as you're kind of going through these things.
Absolutely, I agree. And yeah, it's just so true to we try to help people stay where they feel safe staying, but that isn't always the case, and you're not always allowed when it comes to COVID-19, and as well as your conditions when it comes to your justice involvement. So I will pass it on to Beth and Kim to talk about complex mental health.
Thanks, Justine. So my name is Kim, and I'm a mental health nurse with Inner City Health. So when COVID first came upon the scene, I have to say we were very scared because we care for people with very complex medical and physical health issues, as well as severe substance use and mental health issues. And so, so many of our clients have things like severe COPD. And so thinking about them getting something like COVID, we were kind of mentally preparing ourselves for possibly a lot of death. And so in the beginning, we were being really encouraged to talk with people about end of life wishes and within the context of COVID, and kind of making people aware of the possibility that because of their complex health issues, that they may not be offered a ventilator if the healthcare system became overwhelmed. And as a person who has worked with some of these clients for many, many years, those were really difficult conversations in many ways. But, one of the big things was around the stigma our clients experience, because so many of our clients have had previous negative experiences in the healthcare system, whether it was because they're drug users, because of their Indigenous identity, that to say to them, if this gets bad, you may not get offered a ventilator it felt like it kind of contributed a bit to the stigma of the healthcare system in some ways, of their experiences with the healthcare system. The other thing that was really difficult for us was that everything switched to virtual, and we are directly in the shelters and on the streets with people, and these people that are very transient. And so A, they don't have access to technology, and B, they're not, a lot of our clients, especially, clients who have been living on the streets for years, are not proficient with technology. They're actually very uncomfortable with technology. And, with some of our clients, it has taken us years to develop a relationship with them. Like, it's literally years of me walking by people on the street saying hello, that I've become, me and Beth have become identified as nurses that work on the street. We're street nurses. And so people slowly, will say to us, hey, I've got a problem, can you help me? But to then try and engage one of our clients with somebody who they don't know on a screen is really inaccessible for our client population, especially when you're talking about something like, engaging with people around their addictions or their mental health, something with a lot of stigma and with a lot of vulnerability attached. I know for myself, the idea of doing therapy over something like Zoom was hard, but for our clients, it's who have really difficult time engaging, trusting providers, it was virtually impossible. And so we definitely have seen a decline in people's mental health significantly during this time. And I think as far as, trying to help some of our clients engage in specialist appointments, with significant, wounds and infectious disease, we've had difficulty with that as well. Oh my.
No, that's okay. I'll switch in a second. I just wanted to touch on to, like, conversely, on the youth side of things, we don't have as many of those, like, and this is kind of a boon of maybe working with youth, is we didn't have those same problems around access to virtual services. There were some youth who did not have devices, but that was more related to the fact of their, just their current situation. They couldn't afford it. So we were able to reach out to different service partners or different actually community agencies through a wide variety of kind of working groups that popped up as COVID occurred, and ended up getting a bunch of technology. So the switch was relatively easy for that. And I will say too, within youth populations, it is so unfortunate to hear that experience that Inner City Health has with the older street living population. For youth, there's a lot less comorbidity or chronic health conditions. So we don't see that as much, but certainly reflecting on youth with serious mental health issues or addictions issues, you do see a lot of stigmatization for that when accessing services, and a lot of shame in youth because they are not at a point where they can readily admit that they are able or that they're unable to handle kind of the problems that they have. And yeah, so that was I just wanted to chime in on those two things. Next slide.
So what we really saw was during COVID, we saw such a slowdown of services. So a lot of the outreach housing services and mental health services switched to virtual or only meeting outside during COVID. And then so again, it was very hard to reach the really hard to serve people. Some of these are clients that you are literally having to kind of chase around and find. And so, trying to call them and say, oh, come meet me outside the building, when they, are so ill, just meant that they weren't getting access to care. These are not people that are going to make appointments and keep the appointments. You really have to be able to meet them on the fly. And so for outreach services that, in fairness, were having to change their model because of keeping their staff safe, it did limit access to services for our clientele. Case managers that are usually in the shelters, because we had outbreaks at times in the shelters, and just because of the COVID protocols that were being put in the shelters to help keep people safe, so things like cleaning, hand washing, helping encourage our clients to wear their masks, the case managers got redeployed to doing these different jobs that had to get done to help increase our safety protocols. And so that was also a barrier, as far as the case managers are really helpful in helping people access services, and they were no longer available to do that. So without people having their mental health, without getting their mental health and addictions kind of stabilized, it's a lot harder to house people. So things like ID that Mike and Justine were referring to, if people don't have help with that and are very disorganized because of their mental health issues, those things don't get done, and that's a major barrier to getting housing. The other thing that was really unfortunate is we just saw so many more people become homeless. We had this situation, during COVID, there was new shelters that were opened to distance, and at one point we had at Shepherd's, we had a women's unit, and we said, oh, we're going to have 30 beds available, we're going to have them distanced. And normally in the winter time, especially Shepherd's is very busy. It's crowded, there's mats all over the place. And so there was these different shelters that got opened up, and we were feeling very happy that, oh, we were going to be able to actually physically distance people, because at the beginning of COVID, when these distancing shelters were not open, we weren't able to actually physically distance people. But within very little time, again, the shelters were overflowing, because it wasn't like this, the number of homeless people was a stable number. The number of homeless people, unfortunately, we saw really grow. We had new people come to the shelter that we had never seen before. And so I think, you know, COVID has really shown a lot of the cracks in the system, and a lot more people fell through those cracks in the system and came into the shelters during this time, unfortunately. So I'm gonna ask for the next slide, and Beth is gonna come in now.
Okay, while they do the transition, I'm going to harp on one point that is a contrast between the youth and the adult sector. I used to work in the adult sector prior to going to the youth. And so what Kim was just referring to is, in these facilities, you have situations where you have 12 individuals in a dorm. And in the youth sector, within the 2 shelters that we operate, we managed to get away relatively unscathed from COVID. And we're kind of given kudos for how we organized ourselves. But that's only because we happen to have individual rooms for every single person. And I'm not saying that the adult sector, and this is certainly not to throw shade at them or to say that they're doing a terrible job. I think it's just how it organically evolved over the years. But like, if you're considering ethical ways to treat people, I certainly think stockpiling them in 6 double bunks in one room is not the way to go. So from the onset, I think if there's any learning from COVID-19, it really should be around, and this is a massive undertaking, but it really should be around how you can redesign those shelters to be more respectful of individual client needs and not kind of just warehousing people. So it's my little soapbox moment.
Yeah, definitely. I'm Beth. I'm a nurse coordinator, team lead for Inner City Health, and yeah, I think that that sort of has struck us over many times throughout this whole pandemic, is just that thought of like, okay, so now it's clear that this should have never been happening in the first place, which we all knew, but you know, it's like just trying to apply those principles all the time, and you know, it's pretty obvious what should be happening, and it's just a matter of now we really see the impact, you know, because we kept thinking through this whole thing, you know. These clients obviously deserve that kind of treatment, but also like it does affect everyone when these things aren't in place, right? This population, with the size of it and how high the risk is with transmission of COVID, has the potential to, you know, take down the healthcare system. We were operating under this pressure of like, we need to help avoid that situation where these massive outbreaks can occur and really affect the hospitals and further the spread of COVID in the city. So we were really trying to be mindful of that. And definitely, you know, I feel like looking at COVID protocols, just the most basic things of distancing, clients living in a shelter have very little ability to do that when they're being shoved into small rooms with a bunch of other people, right? So yeah, definitely this is something that's come up over and over again. It's just that thought of, you know, this is really not right. This is not helping anybody. So really just that most basic recommendation of social distancing, physical distancing, not really an option for our bunch. So that was a huge challenge and continues to be a challenge for our clients throughout this whole thing. And I think we've kind of talked about how the services really decreased for our clients and made it hard for them to get out of the shelter, moving into housing, or even recently, like especially with these recent outbreaks in the shelters, even just moving to other programs within shelters. So we would have clients in some of our programs who are, you know, sort of in a beginning engagement sort of phase that, you know, maybe are becoming stabilized slowly in that program, and we would maybe want to move them to a different program at a different shelter with a different level of support. But we can't do that because of outbreaks and not being able to transfer people between. So just really difficult to try to help people progress out of the shelter. And it has really just been this feeling of people being very, very stuck and not being able to leave homelessness, which on top of everything else has just been really morally distressing, because you see the impact of just staying in the shelter for even another week can be literally life altering because of the things that are happening to these people at the shelters. You know, we have significantly toxic drug supply, we have major mental health concerns, and being around this environment where you cannot get away from these really difficult things, it makes it worse for our clients' health, literally, to be in a shelter. So not being able to move them out has been very, very difficult. Yeah, and then just in terms of addiction programming and stuff, this has come up on multiple occasions where, you know, often if a spot were to come up in an addiction program, for example, that's sort of like a coveted moment where you can actually get someone off to somewhere that they can do better and they're ready to do it. But nope, you got to be swabbed first, you got to wait around, you know, so it's just this delay again of, like, you know, trying to help people progress and move on to positive things. You just got to wait, you got to go through these processes, and it's really difficult for clients in those situations, I think, just being stuck, because lots of things can derail a person, and that's one of them for sure. So I think you can move to the next slide, because we definitely covered all of this stuff. So definitely throughout this whole time, we really changed the way that we work completely in the shelters. So one of the major things that we've been doing is really trying to prevent outbreaks and manage outbreaks, which involves a lot of testing. So our entire system kind of changed to just be sort of on the watch for any sort of clients with symptoms at all, anyone in contact. Obviously, just it means that we're swabbing people all the time. So these clients have been really medicalized during this entire process, really getting swabbed often, having to isolate. So if you've been swabbed and you have these symptoms, we're asking you to leave the shelter, go to our isolation unit, which is outside of the shelter. You know, which, so it can kind of like move you away from your supports. It can stop if you're on some sort of a positive streak. You can just have that interrupted and have to exit your life for a minute and go isolate over there. It makes it really tricky for our clients and people trying to access, you know, substances and things like that, that they have addictions to. It's very difficult in isolation. So we had to consider all of these things for our clients, and it definitely has been really hard on them. And so, yeah, just in terms of the outbreak management, when we really had that big influx of positive cases, it made it really difficult for anyone to enter the homeless shelter system when they hadn't already been staying somewhere, or even for people to move around. So if there were issues where somebody was not allowed to stay at a shelter anymore, but they weren't allowed to accept people at another shelter, they might not have a place to go. And so that was incredibly, you know, dangerous for our clients, very difficult on everyone, but most of all the clients. Like, obviously the clients have just been experiencing the worst, you know, effects of COVID, whether it's, you know, actual COVID infection or not. It's affecting them in every imaginable way otherwise. Next slide is great. Thanks, Mike. And then we had a lot of our clients in congregate settings. So Inner City Health, you know, works in partnership with John Howard Society, with the Shepherds of Good Hope. We have Cornerstone Housing. So we, within our own congregate settings, had some challenges and really a lot of ethical discussions at the beginning of COVID around, you know, how are we going to manage this when people are living in these places, and a lot of them are very medically sort of fragile. They've got a lot of complex health issues. And then you've got people that are really actively going in and out. They're leaving, they're going downtown to the other shelters where we know there might be more COVID around. How do we manage that? What are the ethical considerations around that, where you're like, you know, these clients that are maybe not leaving their place and really are very vulnerable to COVID and might die from COVID if it gets into the house? How do we balance those ethical sort of considerations with the client's right to go out and to live their life and do what they need to do? So there were a lot of conversations. We definitely sought a lot of ethical sort of help from Nicolia and the ethics department at the hospital, just trying to weigh how we work that out. And it took a lot of thinking and kind of discussion to try to work out what we would do for these situations. Really, they cut down on visitors significantly at all of these sites. So obviously, if you have family which is a great thing for a lot of our clients to stay in contact with their families. They weren't able to come visit anymore. And so that really just, again, just added on to the difficulty with mental health and social isolation in these congregate settings, made it really hard for our clients. We really had a lot of sort of stories come up of people, not necessarily in our settings, but even just people returning to the shelter because they lost their housing at some other congregate setting because they wouldn't stop going out. They would just keep leaving. And so then they would lose their housing over it literally and become homeless again. So just lots of questions around that. And, you know, is that the right thing to do? It's really difficult to know. So it was stressful and really difficult for our clients when they were trying to balance, you know, keeping their housing safe, keeping the other residents safe at their housing versus being able to still live, because we know that, you know, COVID is going to last for a long time, right? This isn't, at the beginning we were hoping it would be a sort of short-lived thing, but this now we're talking about maybe 2 years of people's lives, and we have really imposed a lot of restrictions on people. So just trying to sort through all of that has been quite challenging and really difficult for our clients for sure. And then in the beginning, we were also quite worried that when CERB started coming out, you know, that the money coming to our clients, obviously we want our clients to be able to have money, they deserve money just like anybody else, but it does present a challenge for them to manage that money in certain cases, that it isn't risky. And then it also was really worrying us that we were going to have people lose their housing because they would have to then pay CERB back and then they wouldn't have their social assistance. So that there was just all kinds of sources of anxiety for us and our clients through the whole pandemic. We're just like every week a new thing. But we were really worried about people not being able to stay in their congregate living setting where we knew that that was the best place for them. But this money was very, very tempting and so easy to access as it should be. So we were quite worried about that. But yeah, so those are sort of our major concerns throughout COVID.
I'm going to tack one on too, because I think we also saw this a lot of what you were just speaking about, Beth. One of our big ethical concerns at the start of the pandemic, and I don't know if it was like this for your agencies or to what degree, but we actually started seeing some othering of clients where it was like, well, we don't know where you're going when you leave this building. We don't know what you're doing. And quite frankly, we think it's dirty. I mean, you know, quote unquote, but nobody actually said they were dirty. But that was the underlying premise, was like, we don't know what you're doing. We can't trust you. And so there was this big push, and it was really anxiety driven by staff around, we need to, like the number of emails I received where it was like, Mike, we need to declare martial law within the shelter programs. And you're like, oh, no, we don't. Yeah, because these are still people, they still have rights.
Yeah, and that the actual major risk in these cases was actually from the staff. Our clients are already so marginalized, and we're really like, we went through a large portion of this pandemic without any major outbreaks. And to us, that just really spoke to like how isolated our clients are from the world and from the city and like just from the places that could give them COVID, which was really like very sad. But then just trying to convey that, you know, okay, let's talk this out. Let's actually look at the risks here, because really what is the big risk is a staff member likely bringing COVID to our clients who are the most vulnerable people. So yeah, there was a lot of anxiety around all of that stuff and trying to sort out what was real anxiety and worth having and not.
Yeah.
A lot of discussions around that.
And the ethics around, and just the ethics around that the staff really wanted on some level to put so many controls on clients that, you know, as managers of staff, we were not imposing those level of restrictions on our staff. A, we didn't have the ability to, B, we also didn't want to. But again, to convey, you know, we're not asking this of you. We also are not able to do this for our clients, and it's not the right thing to do. And so, yeah, that was really, really challenging and really uncomfortable at times.
And I think some of the appropriateness of the decisions that were made through different agencies was really borne out in how we saw the fact that the entire adult sector in homelessness, so the Mission, Shepherds, Salvation Army, only really experienced their first major outbreak 8 months in, which I think needs to be acknowledged and recognized, because that is astounding, given the number of bodies, given the close proximity, And given how quickly like new services with new buildings and new sites and new staffing had to be developed on the fly, I think that is amazing. And conversely, within the youth sector, so far, I'm quite pleased to say we have only had 3 positive cases. But one thing which also within the youth sector, because we are smaller than the adult sector, less attention was paid because the infection rates were also lower in youth. Less attention was paid on what like a medical recovery would look like for young people. So it was kind of we had to do a bit of going it alone, as it were, in terms of, you know, reaching out, creating partnerships, establishing a youth isolation center. What does that look like? Can we get CHEO on board? Can we get some doctors? Can we get some nurses? So we have that all sorted now, but it looks much different than the isolation centers that were required for the adult population. So I just kind of wanted to point that out because frankly, I look at that and I think that's amazing. How long it took.
It was very
and really stressful when it happened too. Like, my God.
Yeah. So thanks very much for those awesome slides. We do have some questions, so I'll just I'll read them out, and then you know, we can bounce back and forth. One question was asked. This was specifically asked while Justine was talking, but it could apply to multiple different groups. Are there services where individuals can go to obtain free PPE supplies to help them protect themselves during the pandemic? So I don't know if Justine wants to take this one, or Beth or Kim.
I can speak to our experiences that we will provide PPE for all of our clients that come into our main office, as well as our outreach. Like, our case managers are bringing that with them to meetings with clients. And then also we're seeing a lot of PPE given by community housing, Ottawa Community Housing, or the City of Ottawa, depending on who is, I guess, managing their housing situation. As for actual street living individuals, I will throw that to Beth and Mike. But the limitation I will say is that we are seeing people getting released from custody with no PPE, and then they can't get on the bus. And then it's so there is definitely a gap there, to the point where we would prefer to meet them at the gates with the PPE if we were given the heads up of the time and date. But as for John Howard Society and housing providers, we're seeing PPE given to clients for free.
Mm-hmm.
All of our clients at the shelters definitely, and in all of our housing programs, can have masks, as many as they need. So like for our particular clients, they definitely have access to that. I'm not sure about people living out on the street, but definitely I'm sure there's a lot of outreach happening, and most of us, I think, are carrying masks around with us right now and handing them out freely.
Yeah, of course. Another question, are your staff, again, to all of you, are your staff being asked frequently to be references for things like housing or ID by clients? And do you do this?
Yes.
Yes and yes.
Yes and yes. All the time.
So we can't be financial. So we obviously can't be financial guarantors. Like, ethically, that would not make sense. We're not in clients' lives forever. We want people to stay housed where they're housed. But as for references up front, 100% all the time, we will do that. We are asked that. It is part of our role.
Yeah, ditto. It's a little more challenging with youth at times. But yeah, because we can't take any sort of legal responsibility for them, which is what a lot of landlords are expecting us to do when we sign off on some of these things. So absolutely, same idea. You cannot tie yourself personally or the agency to any sort of financial commitment, but in a lot of programs, they have lived with us, either within shelter, transitional, or some of our social housing buildings. So will we act as a landlord reference? Absolutely. Will we sell our services and our supports and how we're going to work with them? Absolutely. And will we work to negotiate some of the things away that landlords generally want to see? Yes, 100%. So it doesn't make sense to ask a youth, a 16-year-old, who doesn't even have a SIN card yet, nor a bank account, for a credit check. The money's not even coming from them. It's coming from the provincial government. Like, no, we're not doing this. Sometimes it works, sometimes it doesn't. But for the most part, we tend to avoid hoops that we don't have to jump through if we can avoid them.
And we also have a housing specialist on our team that her role is to liaise with landlords specifically. So she will sell, like, there is a housing allowance. They are getting social support, the money is coming directly to landlord often. So although we can't be financial guarantors, we can explain that the rent is there and it will come in.
Mhm. Another question, so this is sort of speaking to some of the concerns that were raised. So despite laws indicating it was illegal to do this, we saw clients being evicted from residential domiciliary residence due to clients not being able to follow Ottawa public health guidelines and physically distance. Residences refused to tolerate this, potentially infecting the entire residence, and so they evicted the clients instead. So I'm not sure if anyone wants to comment on that or your experience. Or how it's affected you?
We've definitely seen that. Unfortunately, several cases of that. And I mean, from a shelter perspective, it's been very frustrating for for us because, I mean, because of our overcrowded conditions, that it's another person contributing to the overcrowdedness. I mean, I think we definitely have felt for the congregate living settings because, as we said, like as Beth was saying, we have congregate living settings, so we understand the challenges, but at the same time, you know, taking somebody who is stably housed and doing well, and making them homeless there's so many just ethical implications to that. Like, people have the right to housing, and
to move freely around. And, you know, you look at, there's lots of people out there who are not following COVID protocols. And so it's just really difficult to get your head around that, the severity of that. Like, I think like it's the last thing we ever want is for someone to lose their house when it's so difficult to get. And, you know,
it just seems a real injustice. Like, because people who have wealth and who own their homes or rent their homes and are not following the COVID protocols do not have that same thing happening to them. And so it's very unjust. Like, it's, you know, people who are already vulnerable becoming even more vulnerable.
I would be super curious as to those particular situations. So like we also, because we have 4 social housing buildings, I can absolutely speak to how difficult it is to legally evict someone right now. And we do have situations, and it is always our last resort, but we have gotten to points, not COVID related, by the way, where it's like, unfortunately, we do have to proceed down the eviction process, where like the tribunal right now is so backed up. You're looking at almost like a year lag time before you can actually process through something. So I would be very curious as to how those evictions actually proceeded, and whether or not it was some form of illegal lockout, or if their residence was something that actually doesn't follow by RTA guidelines, which is another thing that you have to be very careful about when you are housing people. You got to be cautious that you're actually get that lease and make sure it's a legit lease, make sure it follows the RTA rules, because if you end up housing someone in some sort of shared accommodation situation, where they're sharing amenities with the landlord, then regardless of whatever piece of paper you sign, like that's not acceptable. They can lock you out at a moment's notice, and it's completely legal. So you do have to be mindful of those things.
So we only have a few minutes left, but there's a couple questions here left. So somebody posted, I can appreciate that this may be a difficult question to answer. However, is there something that as an independent individual, we might be able to do to help? So donations to shelters, financial support, items needed by individuals using the shelters like PPE, hand sanitizer.
I feel like all of those things would be helpful. Like, literally, anything you
old phones that are like wiped, and we could put a SIM card in for people that need it for technological, like virtual meetings. That's what comes to my mind. Even just some of the startup stuff that aren't essential right now, so it would be hard to shop for.
When COVID first hit, there were 2 groups that I can think of, large groups that convened, one through the United Way and the other, the Human Needs Task Force. And it was specifically around sourcing donations for things like that. So I was going to mention that previously with the PPE thing. Like, the Human Needs Task Force is always collecting and always redistributing PPE across a bunch of different agencies. I believe a lot of it is even accessible. Mark Taylor made an announcement, well, it was some time ago, but around masking. And this was before, when everybody was doing the cloth mask thing instead of the 3-ply medical, which is now kind of the gold standard for things. So yeah, everything that they said, but yes, donations, absolutely. I would caution donations, make sure that it is, so like hand sand, make sure it's 70%. Anything below 70%, we cannot accept. If you're doing masks, make sure it literally says like 3-ply medical, because within our facilities at any rate, we are not able to wear cloth masks. It is the recommendation for the Congregate Living Task Force to be following along with those guidelines.
Yeah, and I want to echo Justine's point too. Sometimes we don't always think of things like old phones or, technology or something, or if you're one of those people that gets a new iPhone every time it comes out, instead of just, throwing away your old one, you could always donate it in, those appropriate manners to help out individuals for some of those things that don't always come to mind right away. There's one more question, and I saved it till the end, but somebody asked, Jacques Attali, who's an internationally recognized individual, said, poverty creates violence. So could you summarize, and I will caution you that we have 2 minutes left, summarize how this has presented itself specifically in your community? So again, we have 2 minutes left, but maybe just, from a COVID perspective, have you noticed a shift in this perspective, or are you noticing that this is sort of the general consensus of the individuals that you interact with that are not working in this community specifically? So everyone wants to give their 30-second to a minute answer.
I'm glad you left a really easy question for the last one. It's really appreciated.
My first thoughts, I'll give really quick thoughts. My first thoughts are the lack of choices and lack of control are causing violence on the street and in the shelter, and also in custody. People are going into custody and being told you're going to isolation for 2 weeks. So things are not going well. Then they're coming out of custody and being told you need to isolate at your shelter or at your couch surfing situation for 2 weeks before we can help you. Yeah, the lack of control is, people are vulnerable because of the poverty, that they have nowhere to go of their choice. So then they're having a lot of other choices and rights taken away from them.
Yeah, really quickly, I think that makes a lot of sense. I think we all acknowledge that shelter environments are not good for people. It has been shown that the longer your shelter stay is, the worse your outcomes are. You don't have access to housing. You don't have access to stability. You get in the shelter. Something I always used to tell people, like new folks coming in who had never been part of the homelessness system, was if you can get out as soon as you can. If you didn't come into the shelter with a mental health or addictions issue, you're probably going to leave with one if you stay here. And that was a really stark thing to say, but honestly, it's quite true. And that leads to violence. Addictions issues lead to violence. Psychosis leads to violence. Like it's really unfortunate.
And I think from our perspective, one of the most violent things we've seen during the pandemic is the toxicity of the drugs. So from our perspective, the number of people that we've had die from overdoses and the fallout of that for us has been devastating. We had about 10 people die within the month of March, which we've never had before. I would like to comment though, because I don't want to contribute to the stigma of our population, the stigmatizing of our population. There is also an incredible level of compassion and giving. And so, people stigmatize and say, oh, look at all your clients that are hanging out together and not wearing their mask and hanging out, but they're just surviving. And so, A, they don't have a choice, but B, the things that you see where you see people give their mitts to each other, and they only have a pair. And so I would just like to say, as much as I think poverty can breed, it does breed violence. Again, I just want to point to that as being a systemic issue and that not being about our clients being inherently violent or bad people. So yeah.
Yeah. I
Yeah.
think that's a great note to end it on. So just in the interest of time, I want to say a big thank you to Beth and Kim, Mike and Justine for your time and your expertise. If anyone has any further questions or comments, you're more than welcome to get in touch with us and then we will pass it along. So right now, if you could please click back to timeline, fill out the very quick survey, which we really much appreciate. And the next session starts at 10 o'clock. So you can choose an English option or a French option. So thanks very much, everyone, and have a great rest of the day.
Thank you.
Thank you.
Bye.